obstruct the airway, and this can cause laryngeal spasms, and you can eventually die. Okay, die due to reflex cardiac arrest. Okay, and then there is inflammation, inflammatory causes which can cause death. Okay, so inflammatory causes, example, bronchial asthma. So if the asthma is not controlled, it can lead to death due to various causes such as hypoxia, or even medications given during asthma can cause death because it can have various side effects, such as it can cause arrhythmias. Drugs such as salbutamol can cause arrhythmias. This can lead to death. And then other inflammatory conditions such as epiglottitis also can obstruct the airway and cause death, and cause stridor in children. Then lung, it can be pneumonia. And even another thing I forgot to mention, problems in the lung vessels mainly, is there can be embolism. And pulmonary embolism can block the blood flow to the lung, and this can cause death. Okay. So remember, causes of the lung in death, this can be problems in the airway. Problems in the airway can be due to aspiration or inflammatory causes, and then problems in the lung can be due to pneumonia or problems in vessels. So when it comes to pneumonia, usually doesn't occur suddenly, but when it occurs suddenly, it's usually in children because they don't show symptoms. Okay, so in these such cases, it's hard to diagnose it clinically. You have to do a microscopic diagnosis. Okay, let's go to some slides. So this is an example of a pulmonary embolism. So as you can see, this is a dark brown clot in the pulmonary vessels. Okay, and then this is an example of a pneumonia. As you can see, there is consolidation of the lung in the upper part of the lung. Okay, and then lastly, there's few more. These you can quickly run through. So when it comes to the gastrointestinal system, again, it's like what I mentioned before. It can be this. However, then the gastrointestinal it's a very big system. It has many organs, so problems can be due to problems in organs. Okay, so the liver, pancreas, spleen, and even the intestines. Okay, and then problems in the vessels again. You can due to embolism. And so only two things you have to remember: problems in the organs and problems in the vessels. And you obviously know the organs in the abdomen: the liver, the intestines, small and large bowel, pancreas, and the spleen. Okay, so what are the problems that can occur in the liver? Is cirrhotic liver. These patients will have varices. These varices can rupture and bleed and cause death. And then pancreatitis, problems in the pancreas. Problems in the pancreas. One second, having technical difficulties. So pancreatitis, the enzymes can leak, and this can cause necrosis of the bowel, and this can cause peritonitis, and this can cause infection, and this can lead to death. Okay, basically. And then The intestines. Oh God. So problems in the intestine. Intestine is there can be peptic ulcer rupture, obstruction, and infarction of the bowel. In case of peptic ulcer rupture, patient mainly dies due to chemical peritonitis. Okay. Then obstruction, they can die due to again peritonitis or even gangrene because obstruction of the blood vessels. And infarction, they die due to gangrene due to obstruction of the blood vessels. Okay, so these are the main causes, organ causes, as well as vessel problems. So vessel problems, example, similar to a problem in the pulmonary embolism in the lung, there can be mesenteric vessel embolism. So embolism, this can cause bowel infarction, and this can cause gangrene, and this patient can die. Okay, so that is basically summarizing that. Okay, so the ventricular system, aspiration, asthma, hepatopancreatic liver cirrhosis, pancreatitis, thrombosis, embolism, ulcers, intestinal obstruction. Okay, so let's go through some slides. Here is a fatty liver. It's very shiny. They can probably ask you this in spots. Okay, so what are the causes of fatty liver? It can be due to alcoholic or even non-alcoholic steatohepatitis or even high fat diet. And this is an example of a bowel infarction. As you can see, there is a dark area which indicates that there is reduced blood flow and there is cell death happening. And then this is example of adrenal hemorrhage, which mainly can be due to infective endocarditis, where the vegetations can embolize and cause various infarctions in various areas of the body. It can even affect the mesentery as well. Okay, so yeah, that is adrenal hemorrhage. And then lastly, I'm going to talk about the WHO cause of death format. Okay, so this is very important. They can ask you this in any exam. So WH cause of death format. Okay, so WH cause of death format is there. It's written in this way. There is A is the immediate cause, then B is the intermediate causes, then C is the contributed causes, and 2 you can go up to D, and then 2 is basically other significant conditions which contributed to his death. So let's talk about this patient. Okay, so how do you write this patient's cause of death in the WHO format? So A is basically the one is basically the immediate cause of death. This patient had intracerebral hemorrhage. So then what caused the intracerebral hemorrhage? Intracerebral hemorrhage is can be due to aneurysm. Okay, then you should write what caused the aneurysm. What caused the aneurysm is atherosclerosis. Okay, and then so this is basically that. And then the part 2 of this WHO format, what are the other comorbid conditions which are contributed to this? You can write hypertension, diabetes mellitus, and dyslipidemia. Okay, so that is how do you write the cause of death in this particular patient. Okay, now let's talk about this. Okay, this patient, how did this patient die? Okay, so look carefully. This patient died due to fat embolism. So the immediate cause of death is fat embolism. So what caused the fat embolism is can be due to a fracture. Okay, and what caused the fracture is probably RTA, so you don't have to write that usually. Okay, then contributory causes, also there is no contributory cause, it's mainly due to the fracture. So that's all, you don't have to write anything else. Okay, and then what about a patient who had a myocardial infarction? Okay, so myocardial infarction, immediate cause of death is myocardial infarction. What caused the myocardial infarction is atherosclerosis. Okay, and what caused the atherosclerosis is ischemic heart disease. Not cause atherosclerosis. You can write in contributory causes uh, uh, dyslipidemia or diabetes mellitus or even hypertension. Okay, in the hypertension part is you can omit it, but basically the WHO format immediate cause, then the underlying intermediate cause, and then any underlying causes for it. Okay, so basically it's like a chain, it's like a chain. So there is the immediate cause of death, which is the consequence of this, which is the consequence of this. It can go on and on depending on the condition. Okay, so just remember this example. Immediate cause, intracerebral hemorrhage. Why do you get the intracerebral hemorrhage? Is due to aneurysm. Why do you get the aneurysm? Can be due to atherosclerosis. And then other significant conditions which may contribute to atherosclerosis is maybe due to dyslipidemia or diabetes mellitus. So that's about it. So hope you guys understood it. If there are any questions, just leave it in the comments.